everybody. It's so nice to see you here. I know a couple faces, so I'm really happy you guys are all here with me today. I chose this topic because I believe it's something really important, not just for you guys, but for everybody to be knowledgeable about your body. So a little bit of what we're going to be talking today. I know it's a little bit small, so hopefully you can read it. If not, I'll be explaining everything that's in there. We're going to be talking about body mechanics, spinal stabilization muscles, principles of body mechanics, how to safely lift, carry, or push in objects, posture and body control, simple exercises that you can be doing in your daily life, and some research at the end so you can kind of see that I'm not making this up. Okay, first of all, I just wanted to say, like, if you guys have any questions through how the presentation, please just ask them. I'm here to help you. First thing, body mechanics. Good posture and proper body mechanics are essential for your health. Meaning, it's important for anybody that lifts, carries, pushes, or just lift heavy objects, which is what we do in our everyday activities. It's not just for people that works with heavy lifting, but also the stuff that we do like in our kitchen or in our bedroom when we're cleaning our houses. Proper body mechanics are like for our trunks and our spine. It actually conserves energy, reduces strain on joints and muscles, and lower the risk of injuries. And it also supports a safety movement. Engaging all the muscles around our body, it helps to kind of like prevent anything from happening. And it's also a natural brace that is built up in your core muscles. When we tighten all those muscles, again, it kind of just brings you up and it keeps your body tight, and it builds up that kind of brace that you have inside your body. So today I'm going to be teaching you how to use them and do that for you so you don't have to use an external brace. The following picture that you're going to be looking at is the spinal stabilizing muscles. Our core is not just our abdomen. That's what most people think. But it's actually everything around it and what is on top and the bottom. It's kind of like a Coke can analogy. So when we have a Coke, we have the top part, which is our diaphragm, which is the muscle of respiration. I'm going to be talking about that coming up. Then the bottom of the Coke is our pelvic floor muscles, the ones that hold our reproductive organs. It's not just for that, it also kind of like keeps everything aligned for you to move better. Then the front part, which is what everybody looks at, but it's not just the most important thing. And then we have our posterior side as well. So we're going to be talking about a little bit of the anatomy of each of these part of the Coke can, because I believe it's important for us to just know what is inside of us so we're paying attention when we're doing things. So starting with the anterior lateral abdominal wall. So it's going to be that picture of the front of your abdomen. It's the powerhouse, is the one that keeps our spine stable and it keeps us at good posture. We have the external oblique muscle, which is the outer layer, and it kind of comes like this. That one helps to rotate our back and also side bend to one side. Then after that one, in a deeper layer, we have the internal oblique, which is another muscle. It's just kind of built up in different fibers. It also helps rotate our body and side bend to one side. Then after that one, which is the third layer of our abdomen, we have the transversus abdominis muscle. If you can see it on the picture, I know it's a little bit small. It's a small square, very deep. And this one, it kind of keeps that intra-abdominal pressure in our body, which is the one that is the main one that uses as a back brace. And the most outer one, which is the rectus abdominis, what we call our six pack, is our powerhouse, the one that helps us kind of like crunch. Now moving to that posterior abdominal wall, which is your back muscles. So we see them, we have a bunch of different layers in there. So this one is going to be the very deep muscles of our back. A lot of them comes from the spine and attaches to the hip. So sometimes when we're having hip issues, people may think we have back pain, but it's actually coming from that muscle of your back. So we have the psoas major and minor. Not everybody has a minor muscle, but the psoas major comes kind of from like the lumbar spine and it attaches all the way to our hips. So it's a very important muscle because it does two different things. When our femur or hips are fixed, it helps our body move forward. And when our back or spine is fixed, it helps our knees come up. So very important muscle. Sometimes when this gets tight, everything just kind of stops working the way that we want it to work. Then we have the quadratus lumborum, which is next to it, so more toward the side. It comes from our ribs and it attaches down to the pelvis. Again, another big source for back pain. Then we have the iliopsoas muscle, which is built up in two different muscles, with the psoas major, which we already talked about, and then the iliacus, which is in the pelvis. It flexes the hips and it also rotates your leg. We also have the transversus abdominis, which we already talked about in the one before. It just kind of comes all the way from your back and attaches to the front. So that's why it's important when we're working out, when we're doing our abdominal exercises, it's important that we're engaging that whole area, because it doesn't only just attaches here, but it also comes from the back. And then we have the thoracolumbar fascia. This is actually not a muscle, but it's more of, think of like a sheath of connective tissue. It kind of attaches all these muscles together. It has layers built in between. So it doesn't act as a muscle, but when your muscles are contracted, this kind of like tightens up and brings yourself up. So very important, just to keep it in mind. And now, I know I'm not giving a class about these different muscles that I'm gonna talk about right now, but I believe they're really important and very important for everybody to know. So we have the diaphragm, which I mentioned before, is kind of that top part of the can. It helps kind of when we're breathing. So if the diaphragm is not working with your core muscles, there is no good coordination, and we don't have a stable trunk. So when we breathe in, the diaphragm is supposed to expand. Usually when we're doing exercises for the abdomen, we're not thinking about the diaphragm, so things are not getting coordinated, and sometimes this is why people are not getting better. And then we have the pelvic floor muscles, as I mentioned, not all ladies, but also males have a pelvic floor. So very important to think about this muscle when we're doing our daily activities, and again, just exercises in general. So when we breathe in, our diaphragm, which is here, it goes down, and our pelvic floor muscles are supposed to relax. So that's the coordination. When we tighten our abdomen, the pelvic floor muscles come up, and our diaphragm relaxes. So that coordination is what keeps our body aligned, and it helps us do everyday daily activity. So this is supposed to be kind of like a voluntary type of thing that our body does. But let's say you get an injury or you're hurting somewhere, your body is gonna shut down in that area because it wants to protect it. So if we don't make it, using it, or like we don't like try to use it ourselves, it's just gonna stay shut off. So let's do an example. If I'm doing a plank on my knees and I'm not breathing, that diaphragm is not moving. It's just gonna stay tight. So then the muscles of my back are not gonna be moving correctly, and there's not gonna be a good coordination throughout them for you to have a good flow. So just to keep in mind, when we're doing any type of daily activity, when we're gonna pick up something from the floor, when we're gonna push something, we need to be breathing. We need to be conscious of all the muscles around it, because this is what keeps you like a healthy spine and a good posture. Okay, I know it was a lot. So moving on the last two muscles, which are very, very important. Many experts explain different muscles as being the stabilizers of your spine, but they all agree that these two muscles are the main ones for us to keep in mind on when we're doing any type of exercises. Again, it's just not for the core, it's also for your legs or your arms. You need to have a stable core to be able to move the other part of your bodies. So the first one, again, transversus abdominis, is the very deep layer of your abdomen. It kind of acts as that internal brace. It activates before you move your body. So let's say I'm gonna push this. If I'm not activating this correctly, I'm not gonna have a kind of like a smooth force with our arms. So we're just basically gonna push it without using that muscle. Again, it aids in maintaining a good posture and prevents back injury. Then we have the lumbar multifidus. I don't know if you're in that page, but it's those very small muscles through our spine. So it comes all the way from here to the top of our neck. It maintains each of the vertebrae aligned. So if this is not working correctly, or this muscle is kind of just shut off, that's why you may be thinking like, oh, something's aching here, it's not working well. So you always have to keep in mind, it's not just the muscles outside, but what is happening inside that is not helping me to move better or feel better. Usually when we have a back injury or just like an aching, or when you're stressed after your daily life, this muscle gets usually very tired, and this is when you start shifting the way that you shouldn't be. If you have been in therapy before, which I think all of you have, you know, your therapist always tells you, make sure you're breathing, make sure you keep your back aligned, because we need these muscles to be stabilized in your back. If we are just focusing on doing the exercise, not intentional, the injury is just not gonna get better. And again, it's not just for your back, it's for every part of your body. Moving on to principles of body mechanics. Okay, so I just gave you this full kind of explanation of all the muscles. Now what we're gonna talk about right now is like, how do we perform those tasks that we do in daily activities? Before attempting to lift, pull, reach, or carry an object, the following two actions are required to use proper body mechanics. So the first one, position yourself so that your center of gravity and the object's center of gravity are close as possible. With that being said, let's say I'm trying to lift this box. Don't do it like I just did.
That's a real
You're gonna make it work, yeah. Okay. So what it's saying there, I want you guys to, every time you're lifting something, you want to try to keep that box close to you. So your center of gravity is usually like inside around your belly button. It's what keeps your body balanced. If your center of gravity is off and you're gonna pick something from the floor, that's when you can kind of be unstable and fall. So these are stuff that are like, this is something that I may do in my daily activity because it's easier and efficient. But is it easier and efficient for a back? Not really. Maybe if you do it one time, that's fine, but let's say you've been doing it since you were like 10. By now, it's gonna be hurting tremendously. So every time I tell my patients, okay, keep it close, good spine, they're like, but that looks robotic. And I'm like, well, it does, but this is the way that your back is supposed to be moving. So it's just very important just to like, not because it's easier for me to pick the object like this, means that it's the best for your body. And at the end of the day, you do want a healthy body for you to continue to do your daily activities. Okay, the second one is going to be increase your base of support. So in this case, the base of support are your legs. If your legs are farther apart, the more stable you're going to be because your center of gravity, which is dropping in the middle, has more space. The closer my feet are together, the harder it is for me to balance around. If I bend my knees and I bend my hips, I'm also closer to the floor, so I'm gonna be more stable. And this just means, let's say, I'm gonna pick something from the floor. If I go ahead and I do it like this, it's really just a lot harder because I don't have much space on my base of support. If I open my legs and the center of gravity is in the middle, less chances for me to fall. And again, it's just gonna be more efficient for those muscles, less strain in your body. So you just pick close to you, and there is nothing really making effort in there. Another way that you can increase that base of support is gonna be one leg in front of the other as well. So we're a little bit more balanced. Okay. I just gave it a demonstration, but let's just talk about the steps of safety lifting. So you need to plan. I know it sounds super robotic, but it's the more you do it, the more you think about it, the more natural it's gonna become. So the first thing you need to do is kind of plan your activity. If it's gonna be a very heavy job, heavy box, okay, what am I gonna be using? Is it my legs? Is it my arms? So just know what's around you. Get really close to the object first before you lift it. So we don't want to be, let's say I'm cooking here, and then I want to grab something on the side. Let me just grab it. So that's a lot of twisting there. We want to try to avoid it. Come, pick it up, and then put it back. And again, the more you do it, the more repetitions, the more voluntary it's going to come to you. Again, continue to maintain that center of gravity between the base of support. You always want to maintain a curve on your spine. Sometimes we try to kind of like bring the pelvis forward, which is good because you feel more secure. But when you have a natural curvature of your spine, that's when the force, that's how your spine is supposed to be made. So we're not supposed to be making this in or out, because that just creates more forces on other tendons and other ligaments that are not made for your spine. So when we're picking, carrying objects, we always want to try, we want to keep that curvature of the spine. Again, before you move the object, you need to think about tightening those muscles. So kind of bringing those muscles together and the belly button toward your spine. If this is not stable, your arms and your limbs are not going to be efficient. And that's when any type of injury can happen. And also balance. You can lose your balance if you don't have any of that tightened up. And then things to avoid. You don't want to be doing what I just did right now. Like, we don't want to bend and twist our spine at the same time. You want to turn, grab the object, and put it back. Every time you're carrying an object, you shouldn't be turning toward one side and then carrying the object, because again, your spine is twisting and it's not really transferring the force the way that it's supposed to. So if you're carrying something, keep that core engaged, keep it close to you, and look at the direction that you're walking. And then a very common one that I always hear, people tries to just like wake up in the morning and they just start doing all of their stuff. You always need to have a little bit of warm up before you start doing your daily activities. Because when you're sleeping and when you're sitting for too long, that spine just kind of shuts off. It's resting, it's not doing anything. So we need to kind of like give it some fluids, some nutrients, wake it up, and then start doing your daily activities. Then the following one is just 3 techniques, there are many of them, for a safety lifting. So the first one is just a deep squat. What that means is you're going to bring your hips lower than your knees. Again, we want to kind of follow what we've been talking about before. So straight, engaging my core, and keeping a neutral spine. So your hips are going to become lower, bring that object close to you, and bring it up. So we're not using our arms in this one, it's mostly our legs. Then the second one is just a traditional lift. It's usually more when the object is kind of like waist level or at your back level. You basically just bring it close to you first and then you step away from it without any twisting or looking somewhere else. And then another one that is super important, it's like when you're getting things out of your trunk, which I feel like everybody does. Groceries, boxes, anything. You want to put your legs in a staggered position. You want to bend your knees, bring that hip out. You're going to have to use your arms first to bring that object close to you, straight your knees, and then step away. Does that make sense? You want me to do it again? Okay. So let's say I'm opening my trunk. I stagger my feet to have that center of gravity between my base of support. I'm stable. I'm going to bend my knees and my hips, grab the grocery bag, keep it close to me first, and then I move away. Instead of just, okay? And then just few tips on just pushing, pulling, reaching, and carrying. It has the same principle. So everything is just about that center of gravity and the base of support and keeping that object close to you. For pushing and pulling, you always want to keep the force parallel to the object that you're pushing. Also, pushing is better than pulling. It gives you less stress on your spine. So if you ever have the opportunity to push instead of pulling, that's better. So when you push, I want you to, again, bend those hips, bend those knees to increase that base of support. One foot in front of the other, and we're pushing toward the direction of the object. And then pulling same way, you're pulling toward you. Does that make sense?
Yeah.
Good. So for example, let's say I'm going to turn toward the right, and I'm just trying to do this. No. Try to use your body completely, and then I'm going that way, so I'm facing that way, then I push that way. But if I'm just trying to carry and move, it's not gonna be efficient for our back. That will be fine.
Go back this way.
Go back.
Catch myself going twisted.
I can do it.
I don't want you to
It
go
doesn't
back. We're going to help.
Okay.
We're gonna help you.
Soon. Okay, and then for carrying, again, just keep it close to you. The safest way to carry stuff is gonna be either at your waist level, so close to your center of gravity, up here on your chest, or if you have a backpack, on your back is also great. But if you have things just kind of hanging here, or hanging on one side more than the other, your body needs to adjust all the time to be able to carry those stuff.
Groceries,
Yes.
carrying groceries.
Down here is perfect, but both sides.
Yes.
Or if you can, just grab all of them and put them here in front of you. And that's gonna be easier to
So
carry.
if you're carrying a pail of water, you need to have 2 pails of water, even though you need one.
Okay, if you need one, then just put it in front of you and grab it here close to you.
Right.
Does that make sense? Like,
Not let it
This.
hang to the side.
correct.
Right.
Because it's gonna be a lot. Let's say you do it one
That's kinda
time,
hard with a 5-gallon bucket.
then
Yeah.
grab it from the bottom.
Okay.
And then keep it close to your
How about a really heavy purse?
really heavy. I know, those are usually not recommended, but what they say though is, let's say, you put it on your right side all the time, but then if you remember, oh my gosh, I always have it on my right side. Let me put it on my left side so my left side starts working. So it's just kind of having that balance. But they do always recommend just having both straps on. Is the best way to carry stuff. So
The crossbody.
same thing. So if you want to just on one side and then cross it to the other side, it's just all about balancing. But again, crossbody, let's say it's super heavy and it's down here to your legs, it's gonna be kind of annoying because you're gonna have to adopt that all the time. So if you want to make this strap a little shorter, to kind of be a little bit more around here, your waist side, it's gonna be easier for your back.
And too heavy, it pulls on your neck if you get a crossbody.
Yeah, you're right.
So the closer you have it to your center of gravity, the more you're gonna be up straight, and the more you're gonna be able to engage that core to be able to move with it. And again, it's all about balance, so if you have it all the time on one side, put it to the other side every time you remember. Okay, now moving on to posture and body control. Again, everything just kind of falls in together. So posture, strength, and flexibility help prevent back and neck injuries. Spinal stability is essential to maintain a good posture, and especially for movement that requires lifts or extra efforts. Poor posture or weight conditioning can increase the risk of injuries. Even when you're sitting with a good posture for too long, that can actually increase the risk of injury. Your body is not made to just be sitting at all times. Your body is made to be moving not at all times, but it's made to be moving. Common examples of giving stress or strain to your back are lifting and twisting, so what I just did, sitting for too long or standing for too long even, and sleeping just in a very soft mattress, because then it doesn't keep your back in a neutral position, it just kind of slouches you if it's too soft. Some tips for a proper posture. You always want to maintain that neutral spine, so we don't want to be having it tucked it in or out. Sometimes that, depending on what type of back people has, they feel comfortable being like this, but every time you remember, just kind of tighten that stomach and try to keep that curvature of the spine. When you stand or sit, you always want to have that upright posture and not slouching. I know that's extremely hard. Sometimes I'm like this, but what I'm asking you to do is every time you remember, bring your chest up and at least hold it for 30 seconds, and then you're like, oh, I'm tired, you go back to it. But the more you try to remember and the more you try to do it, trust me, it's gonna become a little easier. When you stand, your knees, your hips, and your shoulders need to be aligned. We shouldn't be putting too much weight toward one side. If we are, then switch it to the other side. But when we're standing, everything should be stacked one on top of each other. We always want to keep that head kind of like tucked in so it goes down toward your spine. We never want to have it forward. The more forward we have it, the more tension we're gonna get here. Okay? I don't have a chair, but I can demonstrate. When we're sitting, this is probably too high, but everything should be about 90 degrees. Our back should be supported and the same as our forearms. Our chin should be parallel to the floor. So every time we're walking, if we're walking like this, that's two-way hyperextended. Or if we're walking like that, that's also hyperextended. So always think kind of parallel to the floor is the perfect way that our head should be. The same as when we're sitting. So 90 degrees, our feet should be flat on the floor at all times. You never want to be just like hanging in there or just kind of like slouching. Again, it's not to keep this posture for forever, but every time if you remember, that's going to be a lot better for your back. And again, one of the main tips is avoiding one position for too long. I always tell everybody just to kind of put a timer. If they won't remember, or if every time you remember, move in your chair, twist around, lift your arms, stand up, get that fluid within your joints, and then come back down and sit down. Okay, simple exercises for a healthy back. These exercises, you can do it every day. You can pick 4 and do them however it works best for you. So the first one that I have is shoulder retractions. It's basically just bringing those shoulders back and relax, which is going to help to improve that upright posture. The second one that I have is the posterior pelvic tilt. This one you can do it right now sitting. What we're going to try to do is rock our bottom forward and back and try to find those hip bones on the chair. And what you're going to try to do is draw that belly bottom into your spine and contract those muscles. If you are holding your breath, you're doing it wrong. Remember, that diaphragm has to work with all these muscles. So if you're not breathing, it's not doing that coordination between them. Then we have the single knee to chest. Again, you can do this standing, but you can also do it laying down. Bringing that knee toward you, as I showed you at the beginning, a lot of the muscles come from the back to the hip, from the hip to the back. So we need to have all of them loosen up, because if something's tight, it's gonna pull, and that might be what's giving you that like tiny back. Then we have a partial sit-up. That's gonna be for that front of our body, just to kind of do a small crunch. It can just be on the floor. Your chest stretches. If you're ever feeling tight here, remember you slouch forward. The diaphragm is not going up and down, and then everything just kind of falls down on your back. Hamstring stretch, super important. Just bring it on top of something and lean forward, or even there when you're sitting, just bring it forward and you can come forward. Again, this comes all the way to your hip, which then can affect your back. So everything just kind of like ties up together. Push up, I put it there kind of like modify, so you can do it on your knees, or you can always do it kind of like on the wall.
Or you kitchen counter.
Correct. Again, all these exercises, I do want you to think about how you're tightening those muscles of your back. You have a wall slide, which is perfect for posture. You keep yourself all the way back there, and then you just come all the way down. Again, trying to keep that whole back against the wall. So we're tightening all those muscles around your core. And the last two, we can modify them. The first one is the dead bug, which really targets that transversus abdominis muscle, the very inside one of your abdomen, the main important one for your brain, like a back brace. And then the following one is the multifidus twist, which is for those small muscles of your back. Any questions?
Yes, show us that multifidus twist.
Yes, so basically, you're gonna be here, and I just want you to lift one leg up.
Oh, okay.
And down. Up and down. You could also have something on the opposite knee and drop it down instead of up. I just don't have it right now.
Right.
But does that make sense? It's just working one side of your spine. Because sometimes we focus so much on using just all of them together, but it's very important to also target them small.
Excuse me, that reminds me of push-ups, something like push-ups.
Uh-huh,
Remember we used to do push-ups?
like this one.
Yeah, push-ups every morning, 10 times. Yeah,
That works.
I used to have a record, they used to push-ups, kick-ups. Just do your cleaning.
I love
Off the
it.
floor, do the vacuum, clean your drawers.
I love it.
That's all.
Okay, and then I have two research, so you guys don't think I'm making this up. The first one, it's effects of dynamic neuromuscular stabilization training on the core muscles contractibility and standing postural control in the patients with chronic low back pain. It's just a randomized control trial. Basically what this is saying is they compare just conventional core exercises with the dynamic stabilization training. And the three principles of the dynamic stabilization training is that respiration. So when you're doing these exercises, I need you to breathe in and out. When you're doing the effort is when you breathe out. So exhale with effort. Then the other one is maintaining that curvature of your spine. When you're doing all these exercises, you don't want to be tucked in or slouch or too much like in a curvature. And then the third one is the co-contraction of the agonist and antagonist muscle. What that means is if I'm doing a push-up and I'm not keeping or thinking about engaging my back and I'm just using this, then this is just gonna fall forward. So if I'm thinking about keeping everything tight, I'm using my agonist muscles and my antagonist muscle to keep myself upright. So what they say is when you think about all this stuff, which is basically what we kind of correct you here in therapy all the time, the increments in like the people felt a lot better with their chronic low back pain. So it's not just doing the exercise to do it. You have to think what's inside for actually to be able to work. And then the following research is about the same. It's just more core stabilization exercises and strengthening exercise on proprioception, balance, muscle thickness, and pain-related outcomes in patients with subacute non-specific low back pain. Something that I didn't mention before. If you look at it, they look at the transversus abdominis, lumbar multifidus, and the diaphragm muscle in the research before, which is the muscles that I was mentioning at the beginning. So it is very important for you to think about those, really target those, because they're the ones that are gonna keep yourself like upright and they're gonna give you a healthy back. So in that second research, it's about the same. What they found though is like between the core stabilizing exercises and the strengthening exercises, it's awesome to be strengthening, but again, when people strengthen their back or their muscles, they're thinking about big picture, big muscles, but they're not thinking what's the root of those muscles, which is what the core stabilization muscles work on. So basically what they did in this research, at the beginning they worked more on that breathing, bringing that belly button into the spine, those small muscles that we talked about at the beginning, and that just gave the patient a lot more better of like balance, proprioception, the way that they were moving, it increased so much better than just strengthening. Okay, and just kind of to close out, I know it was a lot. What I kind of want you to take away from this is when we have a healthy core, which is not just our front or our back or side, the top and the bottom, everything else falls perfectly. This is the center of your body. If you don't have a good posture and good balance, everything else is just gonna start kind of falling apart. Again, it's not just for when you're working out or doing specific work. It's just about the daily living. If you pay attention to these muscles, if you take care of your posture and your body, you will feel better. And then you will be able to kind of just like start doing stuff that you probably were not able before. Lower back pain, it's usual. Mostly everybody has it. But if you decrease that strain in your back, it's just gonna overall make you feel better. That is all I have for you today. If you have any questions, please just ask.